Good afternoon, everyone, and welcome to the Lung Health Foundation's Patient Advocacy Day. My name is George Habib, and it's my pleasure to serve as the President and CEO for the Lung Health Foundation. We're so disappointed we couldn't be with you at Queen's Park today, but we thank you for tuning in to what will be an informative and eye-opening event. I am so pleased to be joined today on this virtual stage by patients, advocates, and our political leaders, as well as our NGO partners and our industry partners, and as well our staff are tuning in. Minister Elliott couldn't be with us here today, but had a few words she wanted to share.
Hello, everyone. I'm Christine Elliott, Ontario's Deputy Premier and Minister of Health. I would like to extend my deepest appreciation to the Lung Health Foundation for your compassion and dedication to protecting the health and well-being of all Canadians. During these unprecedented times, your efforts have helped patients and families impacted by lung disease live a higher quality of life and supported caregivers and respiratory health professionals on the front lines in their efforts to deliver essential care to these patients. Thank you. We are proud to call the Lung Health Foundation a partner in our healthcare system. Currently, 1 in 5 Canadians suffer from lung disease, including asthma, lung cancer, and chronic obstructive pulmonary disease. Today, you will have the opportunity to hear from patients, families, and advocates about the very real impact lung disease has on Canadians. As a community, it's important that we raise awareness about lung disease and support those impacted by it. Thank you to the Lung Health Foundation for gathering these powerful, real-life stories and creating a forum for Ontarians to learn more. Together, we will protect the health and well-being of Ontarians. Thank you.
Well, thank you so much, Minister. And now I'd like to turn it over to a longtime champion for lung health in this province, a member of our Lung Health Caucus for many, many years, and a real difference maker in terms of some of the policies that we've put in place in this province to protect Ontarians and Canadians. I'd now like to introduce MPP Franche Elena to give her remarks.
Thank you so much, George. And it's always a pleasure to have an opportunity to listen to the Lung Health Foundation. I have been a big fan of yours for a long time because I have learned so much from you. I want to start by saying thank you for the nice mask that you sent me. It's my favorite and I wear it all the time because people see the lung on it and then they ask me about lung health, which is great. Second, I want to thank all of the young advocates who help push a few changes forward regarding vaping. I had put a private member's bill forward called Vaping is Not for Kids. Not everything that was in this bill was moved forward, but we made some step forward in Ontario to keep vaping products away from youth and kids. We still have a little ways to go, but I like to celebrate the small victories. We made steps forward. The other things I want to talk about, that one is not such a victory, is smoking in movies. I have received thousands of petitions, mainly from young people who basically wanted to make sure that if a movie is going to show product placement of package of tobacco or is going to show smoking on screen, then it not be rated for youth. And the body of evidence has grown to show that if kids see people smoking in movies, it normalizes it and encourages more of them to pick up smoking, with the dire consequences that we know. 1 in 2 smokers dies from tobacco use. Fortunately, we just passed a bill that changed all of that, makes it easier for basically tobacco industry to influence movies, but I don't give up easy. We will keep working on this. And I want to thank you for all of that you've put together for COPD. This is very informative. It will be the type of information that people need to know, that you need to talk to your doctors about it, that you should have a spirometry test, that you need a diagnostic if you want to get better. You can live with COPD. If you get diagnosed, get treated, and the sooner the better. So I also know that the good speeches are the short one. Thank you for inviting me. And if I can be helpful or useful, it will be an honor for me to do that. Merci.
Thank you so much, France. And lastly, I'd like to welcome a not so new member to our Lung Health Caucus as well. And he joined right away when we asked. And thank you, MPP Mike Schreiner. If you could say a few words, that would be great. Great to have you here.
Well, thanks, George. And it's a real honor to join you. And lung health is so important to me. I've had family members with COPD. And so the work you do means a lot to me on a personal level, but it also means to me a lot to me as an MPP and an advocate. And as for the newest MPP speaking to you, I just want to echo the calls of my colleagues. It's just the vital role that the Lung Health Foundation plays in educating MPPs, the advocacy that all of you do, and especially that your volunteers do. I'm a huge advocate in health promotion and preventing illness in the first place. So the work you do around education around smoking and vaping and other preventative health measures is so vitally important. And I want to close by just saying, obviously as leader of the Green Party of Ontario, climate action is one of the reasons I got involved in politics, and it's something that's near and dear to my heart. And one of the things that I'm increasingly becoming aware of is the direct connection between health and climate change, and in particular the research showing that drier summers we're experiencing attributed to the climate crisis can trigger asthma, which we know is one of the leading reasons why children are admitted to hospital. We also know that climate change is changing the way, increasing the length of the seasons around pollen and allergies, which also directly affect lung health. And of course, anyone who saw the forest fires in Australia last year and in the West Coast of the United States earlier this year, I can tell you that my brother and his wife and their 2 young children live in Portland, Oregon, and they had months of the year this summer where they were unable to leave the house, not just because of COVID, but because the air was so toxic that it wasn't safe to take their children outside. And so I'm hoping that we can strengthen our relationship because of the connections between lung health and climate change to really drive home how important it is to prevent and mitigate things like the climate crisis because of the direct effects it has on people's health and in particular lung health. So thank you for the great work you do. And it's a real honor to join you and to continue to listen and learn.
Thank you, France. Thank you, Mike. It's always great to have you as champions, and thank you for your continued support on all of this work. We realize we have a lot. You have a lot in front of you and on your plates as policymakers, but we really appreciate the unique position and relationship that we all have. We can't do it alone. And just for those that are listening, we've had a number of individual meetings from MPPs from all parties, because lung disease really doesn't have a party color, and it affects all of us. And we'll talk a little bit more about COVID, which is predominantly a respiratory disease. So just remember, 1 in 5 Canadians have lung disease, but 100% of Canadians have the right to breathe. So as you know, the Lung Health Foundation is a national charity focused on the lung health of Canadians. We deliver life-changing and life-saving solutions that educate, empower, and inform. We advocate for patients, fund life-saving research, and provide trustworthy information to Canadians. Breathe better, regardless of income or location. When we were here at Queen's Park last year at this time, we certainly had no idea how our world would be rocked and changed as a result of COVID-19. For people living with lung conditions, COVID-19 is especially devastating and deadly. In addition, it has created profound challenges for even those who do not contract the virus, including challenges to pulmonary function testing, spirometry, vaccination, and cancer care. What we have seen over these past 8 months are the gaps we set out to address only deepen. Because of this, the Lung Health Foundation has acted on our obligation to protect Canadians by playing a strong role in the area of the prevention of COVID-19. Beyond COVID, our work includes a commitment to 5 goals in the next 5 years. These are ensuring no one loses a loved one to asthma, helping people with COPD live their lives to the fullest by keeping them out of hospital, giving people with lung cancer a fighting chance by eliminating the barrier of stigma, protecting all Canadians against the impact of COVID-19, and ensuring that older adults don't lose their independence in life by increasing vaccination of influenza and pneumococcal disease. And lastly, ensuring future generations don't suffer the debilitating effects of lung disease by reducing the rate of tobacco, cannabis, and vaping amongst youth. Today, you're going to hear from people whose lives are forever affected. They have graciously offered to be here to share their stories with you. Before I turn it over to our first speaker, I'd like to introduce you to a campaign we have launched in partnership with Lung Cancer Canada entitled Stop Asking the Wrong Question. This campaign was born out of the need to address how the stigma of lung cancer as a smoker's cancer has a deadly impact. Regardless of whether they ever took a puff, people with lung cancer are blamed for their illness. Lung cancer is by far the largest cancer killer in Canada, but it is the least funded. More people are expected to die from lung cancer than from colorectal, breast, and pancreatic cancer combined. Sadly, lung cancer survival has barely improved in the last few decades, with only 19% living 5 years after diagnosis. Stigma has stalled funding and delayed diagnoses that gives people living with lung cancer a fighting chance. Here's what patients have to say.
The first time I told somebody outside of my wife, the first question they asked was, well, you weren't a smoker, were you?
The first thing they would ask is, have you ever smoked? Were you around a lot of secondhand smoke? Not many people first asked, how are you doing? Or how are you feeling? Is everything okay?
I can sadly say that when you get a lung cancer diagnosis, no one comes to your door with a casserole wishing you well.
It's now my pleasure to introduce Marianne Bradley. This special lady is a lung cancer survivor, a participant of our anti-stigma campaign, and a member of the Lung Health Foundation's Cancer Patient Advisory Council. Marianne?
Good afternoon, everyone. My name is Marianne Bradley, and I am a lung cancer survivor advocate. I was diagnosed with lung cancer in 2014. To hear those words, "you have lung cancer," were completely devastating to me. No one ever wants to hear that they have cancer, let alone lung cancer. My father had died of lung cancer in 1990, and now I was facing the same diagnosis. I had a biopsy of my right lung, which confirmed I had stage 1 adenocarcinoma. Since my cancer was found early by an incidental finding, I was considered a candidate for surgery. I had a VATS procedure for removal of my right upper lung and I am now a 6-year cancer survivor. At that time, there was little or no information pertaining to lung cancer. I finally found an organization in the US called Longevity. I was able to find out all I needed and more about lung cancer. However, it troubled me that the information I was learning was strictly from the US. I wanted information from Canada. That is when I found Lung Cancer Canada, who were able to provide the necessary information pertaining to staging, treatment options, clinical trials, targeted therapies, and immunotherapies, and advocacy. It was then that I chose to advocate for those cancer patients who can't advocate for themselves. Currently, I am the co-chair for the programs committee at Lung Cancer Canada, and I sit on the advisory committee for the Lung Health Foundation. I am proud to say that both of these organizations have given me the strength to continue with the education needed so I can continue my work with lung cancer. I have helped to initiate a Facebook group, the Canadian Lung Advocacy Breathe Hope. This group is for Canadian cancer patients and caregivers that gives support for those living with lung cancer. In addition, in this group, there are many discussions on stigma, early screening, and cost of medications for targeted therapy and immunotherapy in lung cancer. I recently had the opportunity to participate in the anti-stigma campaign, The Wrong Question, with the Lung Health Foundation. No one deserves to have lung cancer, whether you smoked or not. Instead of people saying, "Did you smoke?" the right question would be, "I'm so sorry to hear you have lung cancer. Is there any way I can help?" People who have lung cancer deserve the same respect as others who have cancer. Many lung cancer patients who have smoked blame themselves for their cancer and will sometimes not seek the help that they need because of the guilt associated with smoking. In some cases, patients and caregivers have experienced different treatment than others who have never smoked. The stigma behind lung cancer must stop. The language needs to be changed to end the stigma. Part of my advocacy is talking about early screening in lung cancer, something I am very passionate about. And recently I spoke with my thoracic surgeon, Dr. Christian Finley, who asked if I could speak about how the doctors feel about early screening and how important it is to find lung cancer early. This is what he had to say. Lung cancer kills more people than breast, colon, and prostate combined. We have world-class evidence that lung cancer screening reduces mortality by 20% and can be done in a cost-effective manner. Justifiably, Ontario chose to make sure it piloted its program to ensure that it was done on the appropriate patients with the best supports, such as lung cancer screening and smoking cessation. That pilot has finished with great success in the 4 sites initially chosen. And now it is the time to broaden it to include the most vulnerable and at-risk populations. To make matters worse, for those people, the pandemic has dramatically decreased the number of patients who are found incidentally, which is how it occurs without screening, such that fewer patients are being found with treatable cancer. These patients are presenting now with advanced and untreatable disease. The revolution of technology makes the adoption of screening safe, cost-effective, and absolutely necessary. Ontario needs to invest in funding further sites for lung cancer screening now. Lung cancer also has obstacles regarding provincial coverage for targeted therapy, such as a drug for RET mutations in lung cancer. Across Canada, Most provinces are covering a drug called crizotinib. This drug effectively extends life to a stage 4 lung cancer patient with this mutation, and yet in Ontario, like many other medications, there is no coverage. At stage 4, there are not many possibilities to live well with lung cancer without the help of targeted therapies or immunotherapies. These medications can honestly add years on to the life of a lung cancer patient. These medications need approval, so a lung cancer patient does not have to face the decision that they may die without this medication. Thank you for giving me this opportunity to talk to you about my advocacy in lung cancer.
My sincere thanks, Marianne, again. I've seen Marianne in a number of these meetings, and Marianne, your voice, your story is making a difference out there. Thank you again, and thank you to our partners at Lung Cancer Canada, to SHAM, to their president, Paul Wheatley-Price, who have advocated so strongly and been amazing partners to work on this campaign that we hope will end the stigma to lung cancer. Marianne mentioned a comprehensive lung cancer screening program is absolutely essential to improving lung cancer survival rates. With the proper screening protocols in place, 75% of diagnoses are at an early stage when curative treatment is possible. We hope to work together with the Government of Ontario on this important initiative moving forward. I'd now like to introduce our second speaker, Anne Roosevelt. Anne is the mother of Gabriel Roosevelt Jackman. Gabe was one of our youngest and most passionate ambassadors, always willing to share his story of living with asthma in the hopes of making change. Sadly, Gabe passed away from an asthma attack in December of 2019. Anne, thank you so much for being here today and agreeing to share Gabriel's story with us.
Thank you, George, for your warm introduction. And hello, everyone. I'm a mother of 4 children. I'm here to speak on behalf of my sons, Gabriel and Solomon. Gabriel and Solomon both have chronic asthma and severe allergies. Gabriel was introduced to the Lung Health Foundation, that was then the Ontario Lung Association, when he was around 10 or 12 years old, through the respiratory clinic at Sick Kids Hospital. Gabriel specifically over the years assisted the Lung Health Foundation by bringing awareness to asthma. Regardless of the type of asthma any individual may have, it's a disease that should never be overlooked. Gabriel and Solomon both have a respiratory specialist that they see on a bi-weekly to monthly basis. Gabriel especially had an allergy specialist also to help balance his respiratory reaction from any allergy triggers. At the age of 18 years old, Gabriel collapsed last year, August 2019, having a severe asthma attack. His younger brother, Solomon, was by his brother's side in hopes this was another episode that prednisone, inhalers, or oxygen, or a nebulizer mask would aid in Gabriel's breathing correctly again. Unfortunately, Gabriel was not given oxygen or any correct assistance in the first few minutes that were required. He was laying on the ground for 21 minutes while paramedics stood there looking at Gabriel baffled. After being in 2 hospitals, Gabriel's heart stopped beating September 2nd, 2019. The investigation is still ongoing. I wanted to share this story with you today to bring awareness to the fact that asthma can be a very dangerous disease. Asthma support and improving asthma care continues to be extremely important for patients. Over 850,000 children across Canada have asthma. I hope that this story serves as an inspiration to all to give asthma patients the attention, care, and support that they all deserve. Thank you for listening, and thank you for your time.
Thank you so much, Anne. You know, it's truly heartbreaking that asthma attacks still take lives every year. And the challenge here is that asthma attacks are still responsible for over 60,000 emergency room visits across Canada. And we're proud to be partners with the ministry here in Ontario as the primary care with our primary care asthma program focused on emergency departments and everything else. And we've been reducing visits, but we still have a long way to go. And with the rising prevalence rates and the burden asthma continues to place on the healthcare system, continued support for the management of asthma is so desperately needed. We know that with more timely diagnosis, the right treatment, and better disease management, these emergency room visits are largely preventable. Next, I'm pleased to introduce two young advocates we have with us today who are going to tell you about their experiences with vaping. Canada is most definitely facing a vaping epidemic right now, with youth vaping rates increasing 74% a year. With COVID-19, the risks associated with vaping are even more profound, with initial studies suggesting that the youth e-cigarette epidemic contributes to the current COVID-19 epidemic. The Lung Health Foundation administers an online youth vaping and smoking cessation program targeted at youth ages 14 to 19 who are interested in quitting smoking tobacco cigarettes, vaping e-cigarettes, or both, and we call it QUASH. Our next speakers, Ethan and Aidan, are members of our Youth Vaping and Smoking Cessation Advisory Council. They are very important partners in helping us build this app to be as effective as possible. Over to you, Ethan and Aidan, to tell us a bit about your personal stories.
Hi there, everybody. I just wanted to say thanks on mine and Ethan's behalf for having us. We really appreciate this opportunity. So to start, like many other high school freshmen, my main goal was to fit in to the crowd. And by doing that, vaping started to really show with everybody. So you go to the change rooms and you would notice all the students would have vapes. They would be the bigger box mods, because this was probably, I was in high school, 2015 and 16 was my freshman year. So that'd be the time. Hitting the vapes in the locker rooms, they were all zero nicotine. It was just for the tricks. It looked cool. And being able to do set tricks allowed you to fit in with the crowd. And knowing that these vapes costed me money, I went to the vape store as a 16-year-old and tried my luck. Surprisingly, I got lucky, and well, not lucky per se, but at the time you would do it as that. And I wasn't ID'd at that store, and there I had it. I had my own vape, and it was in my face. This was also at the time where zero nicotine was what I was vaping. It was no juice, no addiction setting in. Now, fast forward to about 2017-ish, I would say. And you started noticing pocket vapes, or what I call them, pocket vapes. They started to become more prevalent among youth. Those are the things such as Juuls, Nords, or the Smock Novos. Those would be the main three that I would recognize. And with these smaller pocket vapes, they were highly powerful and they burned nicotine at a higher rate. So the juices could now contain nicotine and nicotine salts, which is a physical, not dissolved form of nicotine that's within the juice. These higher nicotine contents and the ease of access that these vapes provided really created an environment for addiction to set in without the students not really knowing or caring of what was happening to them. I actually battled with the addiction myself. I had Juul devices, and that battle lasted probably 2 to 3 years, and I'm very happy to be over it now. But it was a time in my life where you didn't really know what was happening, because the health impact of vapes isn't really known. So I've noticed. So you could fast forward nowadays, and you notice that almost, I would say 50% to 75% of kids will have one of these highly powerful pocket vapes on them. And just addiction is rampant. And something needs to be changed, in my opinion. I'll give it to Ethan now.
Thanks, Aiden. Yeah, my name's Ethan, and thanks everyone for listening. I'll start by describing how I started vaping. It was similar to Aiden in the sense that I gave in to the pressure of social groups and other events where people were offering, and I didn't really feel like it was hard to say no, because I wouldn't really say that I was pressured into it, more so that I didn't think it was bad. And since everyone was doing it, it felt natural for me to just set in and start doing it myself until I eventually decided to get my own. And just like Aiden also, I just rolled the dice and decided to try my luck at a vape shop and see if I would get ID'd. And being from the small city of Sault Ste. Marie, where we're from, there was multiple vape stores, which meant multiple opportunities to try and not get ID'd. So I was lucky, and I got my vape on the first store we went to my surprise and everyone else's, because I looked even younger when I was in high school. And from there, we started to gather and just vape together like it was an activity. And we had all been setting in this terrible addiction on repeat, and consuming large amounts of nicotine that was just terrible for our bodies and our mental health as well as our physical health. Yeah, and then as I started to question the health sides of vaping, I really realized from my perspective that, sorry, let me rephrase that. Ultimately, from my own perspective as a teen in high school, I was vaping for fun. I was addicted to the nicotine rush, and I didn't really care about the consequences that vaping or nicotine addiction would cause. I acted like social status was the highest priority, and it led to numerous bad habits. And I feel like for other teens, they feel the same way. And I think that's the greatest danger that vaping offers to teens. Thank you.
Ethan and Aiden, thank you so much. If your presentation is just a sample of your leadership and moving forward to be able to save lives through the initiatives that you have, your leadership is welcome. And you can tell, ladies and gentlemen that are listening, Ethan and Aiden are examples of our young people moving forward that are taking leadership positions. So the future is bright for all of us. I want to thank Marianne and Ethan and Aiden again for that. Just coming back, the sustainability of programs like Quash that we're going to be launching are going to be integral in the coming years, with the continued support, the need to continue to support youth who are interested in quitting. I encourage all of you to take a look at the policy packages shared earlier with you. Here you're going to find actionable, and I'll emphasize the word actionable, policy recommendations that will begin to address the major challenges facing lung health, including in the area of youth vaping, cessation, lung cancer, and asthma. And also we'll be having again our MPP newsletter going out, and you'll hear and see more on this. So the MPPs and staff that are on, please look for that. So ladies and gentlemen, this brings us to an end of our formal event. While we have had several meetings with many of you today, our work continues beyond our annual Patient Advocacy Day. Please feel free to reach out with any questions or to set a meeting with our team. This is a crucial time for all of us to be working together in protecting the lung health of Ontarians, and you can count on our support as we face these challenges in the months ahead. I'd be remiss if I didn't thank again all of you, all of our speakers, but also the staff that worked so hard behind the scenes to prepare the presentation today. Have a great day, be safe everyone, and we'll look forward to talking to you soon.
Thanks, bye now.